Hello, everybody, and welcome back to the Genesis Birthing and Living Listening to Black Women web series. Today, I have with me Abrielle Banks, and I will let her introduce herself and tell you where she's from and a little bit more about herself. But I just wanted to welcome you back to the Listening to Black Women's web series. And if you tuned in before, I hope you're excited to tune in this time. If not, be sure to like, share, subscribe, and tune into some of our older videos after you watch this one. All right, Abrielle, tell the people who you are.
Hey, so I'm Abrielle Banks. I am from Marianna, Arkansas. It's really rural area. I am 23 years old, a mom to one baby girl. This is Miss Olivia. She is 5 months old now. And I am a labor and delivery nurse. I have a background in doula work. And yeah, that's what I do.
Okay, cool. I didn't know that about you. I didn't get to listen to your podcast because you signed up yesterday and I found out about you yesterday. So this is gonna be like new for me, but what stood out to me about you, I saw your post and you were talking about all of these factors that you've gone through in labor, and you just seemed really excited to share your story. And I love sharing Black women's stories, so when you're excited to share your story, I'm excited to hear it. So I'll start with the first question. How many birth stories do you have?
Just one.
Okay. And is that Miss, I'm sorry, Olivia, is that what you said her name?
Olivia with an A.
Okay.
Yes.
Okay. How old is she?
5 months.
5 months. Okay. That's beautiful. All right. So tell me why you want to tell your story and why you think telling your story is important.
Because I think representation is important. I want Black women to see other Black women in these spaces. I have been operating in the birth world for quite some time, and there's just not really a place for us. And even my best friend, she was not super excited to share her birth story ever, just because she didn't feel it compared to other people's birth stories who didn't look like her for some reason.
Mm-hmm.
I just want to put an end to that.
Okay, that's good, and that's kind of the point of this web series is for us to tell our stories and to, like you said, develop a sense of pride around our story, no matter what it looks like, and to learn from each other's stories, and of course to heal if there's any trauma that's associated with your birth. Telling your story and seeing how it helps other people and definitely help you to heal. She's so cute. um, So, what are most birth stories in your family like? Are women sharing birth stories like that? What do they sound like when they do
That's
share
where
them?
I would like them to, of course.
Yeah.
um, but they were mostly vaginal births. A lot of them natural, but not necessarily on purpose or because of education, just because like a lack of resources or a lack of respect in the healthcare system.
Mm.
But there were lots of like, natural vaginal deliveries, which made me feel hopeful. Not that their birth, you know, would determine how mine would go, but that still was, that felt good to me to hear.
Yeah, no, though it does kind of not maybe not determine, that might be a strong word, but it does inform how your birth goes, because it affects how they talk to you about birth, which is what I'll ask before I get into my rant. What were the conversations around birth with you once everybody found out you were pregnant, like, or even beforehand? Like, what were the conversations from women who had birth to you as you were going into birthing?
For my family or just people, period?
Well, your family primarily, but also your community, your larger community, anybody you ran into, but your family specifically.
I feel like there wasn't really much conversation with my family. My immediate family already knew that like I was a doula, I wanted to go natural and I wanted to have a doula. So they already knew my plans and they, trusted those pretty well. So there wasn't ever a big discussion. I was gonna go have a baby and come home and that was it.
Okay.
And they respected that. And with my community, I kind of had a difficult pregnancy, so I didn't necessarily like discuss my birth plans with a lot of people. I know that like I was having to deal with a lot of other stuff emotionally, and I was not interested in fighting for my
Okay.
birth plan with people who didn't even matter,
Right. Yeah. I know what you mean.
I'm not gonna add that to my plate.
Okay.
But
That.
I was always vocal about, these are my plans. This is what I want to do. I guess with my work community, it was a big discussion. But they also respected that. They know that I had seen it, that I witnessed it, and that I believed in myself. So they were like, okay, sis, let's go.
Okay. Okay. And you say what type of nurse did you say you were?
Labor and delivery.
That is okay. What? Let me ask. How did that go with your work community and with your experiences at work, coupled with your experience as a doula? How does that work, first of all? And then how did that inform your birthing experience, or at least your preparation for birth?
So when I first made it, I had only been working on my unit as a labor and delivery nurse for 4 months. And so during that 4 months, I was already the crunchy nurse, and they, gave me the natural patients and stuff like that. Like they knew that that's, where my head was. And so they would always like talk to me about, natural birth and things. And so when I got pregnant, they were already prepped. Like I had already done that footwork with them. And so then it just became a matter of them, like every shift, like asking me, do you plan to do this? Okay. Well, do you plan to do this? And so then when D-Day came, like there were no questions. Everybody knew, and it worked for us.
That's good. So you labored at the hospital that you work at
Yes.
Oh, that had to be nice.
Mm-hmm. It
Yeah.
was.
Okay. So well, let me not skip ahead because this is interesting to me. So about the statistics of Black women in birthing, and I'm sure you had that on your mind, or at least it came across your mind at some point going through this process. So I guess I'm wondering what about your being a nurse and being a doula? What do you think? What do you think the advantages that you had or have that maybe some other Black women don't have, that could maybe speak to some of the issues that we're facing in the Black maternal health space?
I'm glad you brought that up because I know people probably they listen to me and they think, well, she has like this huge advantage that nobody else has.
Mm-hmm.
So I do want to speak to that. I mean, I knew I'm more of a doula than a nurse, if that.
Okay.
In the birth world. Do you know what I mean? Like I'm way
No,
more.
I'm gonna let you explain it though.
Like midwifery care is my heart. So like I work as a nurse in labor and delivery in a hospital, but I still like low intervention birth is my goal always.
Okay.
If that's what mom wants,
Yeah.
So with that being said, I trusted birth, I trusted my body, I trusted my baby. So even though I had this clinical experience and knew like all the things that could go wrong, I also knew all the things that could go right. And the factors that it took, to facilitate things going well.
Okay.
Or as well as, it was destined for them to go.
Okay. Okay. Can you talk about some of those factors just for women who might be watching? Like, what are some of the factors of that could help things go well?
Being active in your pregnancy, educating yourself in your pregnancy. One thing that I've started doing lately, which some people in the medical community might not like, is having people like study fetal monitoring. So it's really not that hard to pick up, and there are so many resources accessible to like the general public. And so I hear a lot of people saying like my baby was in distress, so they had to take a C-section, but it wasn't a crash C-section, so like something obviously wasn't that wrong. So I'm like, learn, what a deceleration looks like and what that means for you, and the things that you can do to change those factors. So being educated, having an active pregnancy, learning about movement during labor, things that'll facilitate, a baby being in an optimal position. Because I think a lot of times we think my service is just going to open and the baby's going to come out. Well, baby needs us to do some work first. And so I think it's important that we know those things. Having a doula, knowing, your options, knowing that you have autonomy over your own body. You can say no, or I need a minute, or let's discuss this further. When I see a lot of women going into the healthcare system and then they give up all their rights because the doctor knows best, or, the nurse knows best, but your body and your baby, and we don't know you.
Mhm.
Bottom line, we don't know you or your baby.
Yeah.
Trust you're good. You know, like we do have knowledge that a lot of people don't have. But at the end of the day, I think holding on to your intuition is super important.
Wow, that is so good. That's so good. That is so good. So what do you think some challenges are that nurses might face when they're encountered with natural patients or patients who have doulas or who want to advocate for themselves, but that's going up against all the things that you've learned as a nurse, going against your professional experience, or maybe if it's not going against it, just what could be challenging as a nurse um, to be in that space or to be in that situation. Do you
Okay.
get what I'm
So,
saying?
yes. So even though I have this heart as a doula, I still have a license as a nurse,
Right.
and I have to protect that license.
Mm.
That's my livelihood. And so when you're in labor, I have a duty to keep an eye on your baby. If the doctor orders me to have you monitored continuously, then that's what I'm supposed to do. And not doing that and potentially having a bad outcome is looked at as neglect. So I do, if you come in for an induction, a lot of women come in for inductions and then they don't want to be on the monitors, but they don't realize that these medicines we give to you to induce your labor are potentially harmful for you and baby. There are so many risks associated. So I'm going to induce you because that's what you want, but I also need to make sure that you and your baby stay alive, that your uterus is not rupturing because,
Mm.
too much side attack.
Yeah.
And so it's hard balancing that because I want you to feel like I don't want to take away your autonomy, but at the end of the day, we gotta, weigh the risk versus benefits. I need to keep an eye on you. And I know it's like super annoying and you want to be able to move because like at my hospital, we don't have wireless monitoring.
Oh.
Yeah, so you have to stay within like 4 feet of your bed. And so, I know it's not fun, but I mean, I still, as a nurse, I have responsibilities like legally that would literally like ruin my life if I didn't uphold.
Yeah. Yeah.
That's difficult.
So with that being said, you said like use induction as an example. So if I'm a mom and I want to have more, like you said, autonomy, would it be easier if I just did as much of the process natural as possible? Like, would I have a better chance of
Absolutely.
not being monitored if I didn't get an induction? If I, you know what I'm saying?
Absolutely. So you do typically still have to speak with your doctor, and I do recommend having a birth plan and having your doctor sign it, even though they might not be the person delivering you if they're not on call. Having your doctor have your back is really important on paper.
Okay.
Other doctors
Okay.
are way more likely to, facilitate whatever you and your doctor discussed.
Okay.
Um,
Okay.
yeah.
That's good. I like that. Having your doctor have your back. So women, if you're listening, if you want a natural birth, you kind of just the whole atmosphere kind of has to be natural, or at least you have to have a doctor who agrees with it, or like you said, who has your back on it, and then maybe try to find as many natural methods of of birth as possible. Try to
And
start natural and finish natural if you want to finish
yeah,
natural,
if you
basically.
come in natural, we are like out of your hair because like we want to protect your headspace, your
Okay.
your world to keep facilitating a physiological birth. So we don't, if you came in natural, we're not doing like excessive cervical exams. We don't have to worry about you have an epidural and your blood pressure is really low. So now your baby's
Okay.
we got to flip you back and forth. Like we don't do that. When labor women are like bears, like, and I love
Mm,
that. Like that's a good thing. Birth is wild, and it should stay that way.
yeah.
And so we don't go poking the bear. So
Yeah.
you're definitely much more likely to have the experience you want. Um, you know,
Okay.
coming in after having let things, let your body do that work at home.
Yeah. Okay. That is so good. Thank you. um. Okay. So you have experienced natural birth, some interventions. You had suspected infertility here. So talk a little bit about that. So you did have a natural birth, okay? And so what were some? And I also saw that you said you had is it diabetes, type 2 diabetes? Is that what you said? And was there other list of things that you I'll let you talk about.
So I'll start with this suspected infertility. So when I was 15, I was having all these issues and like nobody could figure out what it was. We eventually found out that I had a dermoid ovarian cyst, and
Okay.
they are made of like fetal cells that would have turned into different like body parts and things. Not like parts, but like hair, teeth, things like that. So they
Wow.
have to come out. They can't just rupture and pass, you know.
Okay.
So I went into surgery. Um, and didn't know whether I was going to be able to keep my ovaries or not. I came out, still had one, but
Okay.
I would still get cysts on it pretty frequently, but they weren't dermoid, so they would rupture and go away, you know, but there was still risk for like torsion, ovarian torsion and stuff like that. Well, then I started having issues again, and then I was told that my tube on that one side was blocked. So
Okay.
my OBGYN at the time was like, you'll have to have some work done, you know, to be able to conceive, but we won't do, you know, let's not do any of that until you're about to conceive, because, you know, it'll be in vain anyway.
Okay.
So I was thinking that I couldn't have a baby.
Wow.
Yeah.
Wow.
Or that it would take some work, you know. So I was dealing with that and then had a surprise baby, of course. And then the interventions that I was speaking about was just the Pitocin. So I woke up to my water broken, and once I got into the hospital, I got antibiotics because they didn't know my GBS status.
Okay.
And I wasn't contracting like almost at all. I had been contracting my whole pregnancy, and that day they still weren't as intense as they had been in the past. And so for me, I, you know, weighed my options and decided that, you know, going ahead with augmenting with Pitocin was the best thing for us, because I was in the hospital. I did realize that they put me on a clock. Of course, I had some wiggle room because I worked there and I, you know, had this knowledge and stuff. But I did kind of want to go ahead and like facilitate the process.
Okay. So I have some questions about that. I'm gonna come back to that. But you with the dermatoid fibroid, is that what you said it was called?
Dermatitis. Mm-hmm.
Dermoid cyst. Okay. Was that a result of a pregnancy, or is that just a natural occurrence that happens?
I think it's when I was a baby, they just
Oh,
stuck around, something like
okay.
that. But no, it's not the result of a pregnancy.
Okay. Okay.
That's perfectly
Um, okay. And so how I also saw that you identify as Christian. And so I
Mhm.
like to ask when I see that, because I do too. Obviously, Genesis, birth and living. Yeah. So I like to ask, how do you feel like your faith informed or supported you through this process where you didn't think you could get pregnant, and like now you're pregnant, and I don't know, did you have dreams of being a mother, or was it like,
Oh,
all right, well, I can't get pregnant, so I won't even think about that, or
I always So I always, in the back of my head, I was like, I can't get pregnant. I'm not going to think about that. But I did always have dreams of a baby. In fact, I thought she was a boy because for years, since my senior year of high school, I've dreamt of a baby boy named Xavier.
okay.
And and he would come to me in different stages of his life. And so I'm like, I'm going to have a baby boy. I might not name him Xavier, but
Right.
right. Um, and so I had I had faith that I would be a mom somehow, but eventually I had to like change my thinking from thinking that the only way that I could be a mom was to, you know, be pregnant myself, or, you know, the baby be my own egg. So I had to let go of that. I feel like is the spiritual work that I had to do surrounding it, letting go of what my idea of a mom was, and accepting that, you know, that might not be God's plan for me.
Wow. Okay. Wow. So what was it like finding out you were pregnant?
Oh, it was a surprise. Like my niece is the one who told me that I was pregnant, and I was like,
Oh, okay.
no. She was 17 at the time, and I'm like, no, impossible. Like I'm not. You don't know. Hush, child.
What made her think that?
Because I was in Memphis. I had been commuting back and forth, but I got my first place there, and she came to stay with me. And so I'm like taking her around to all my favorite food places, and I'm like, this stuff is disgusting. Like, I'm so sorry to do this to you. She's like, no, this food is bomb. Then we lay down for bed, and my shirt was rubbing against my breast, and I was like, oh my gosh, that hurts. And she was like, you're pregnant. And I'm like, man. And then she left after a day or two. and I was just in bed, just exhausted. Like I could not stay awake. I just felt bad. And then it's almost like I heard a voice say, like, go take a test. I'm like,
Wow.
okay. So I got up and took a test, and then I was pregnant. And I'm like, oh crap. So
Okay.
I wasn't ever like in disbelief, but I was definitely shocked. And it took, like I wrapped my head around it pretty quickly, but I still was like, okay, is this really gonna happen? Like, or am I gonna lose this baby? Like, am I gonna stay
Yeah.
with it? So even when I got pregnant, I feel like I didn't trust that I was still gonna be somebody's mama. Like I took a minute to accept that. I was so worried that I was gonna lose that baby for some reason. I'm like,
Yeah.
no, this baby had to go through a lot to get here. Like, surely they'll stick around.
Yeah. Oh, that's beautiful. That's beautiful. Okay. So, fast forward, you were pregnant. What was your pregnancy like? Were
So
there any complications or anything, or?
yeah, so I had hyperemesis and I lost 30 pounds.
Okay, I'm sorry. So with hyper what now?
Hyperemesis. So like I was
Oh,
extreme, like morning sickness was
okay.
extreme.
Okay.
All through it's not definitely not just morning sickness. It was all throughout the day. But I was just
Wow.
constantly throwing up. I had so many aversions to food. I just wasn't really eating much at all. And so I ended up losing 30 pounds. And
Wow.
around week 22, I wasn't throwing up as often, but still pretty often. Just kind of tapered off a little bit. But then I started having preterm contractions. So then that was, something else. But I mean, I still loved being pregnant. It was hard for sure. And I was still working 12 hours in the hospital on night shift.
Okay.
Yeah.
Wow. Wow. Okay.
But I still loved it.
Okay. Okay. And so you went into labor naturally or spontaneously. And do you think that helped you to decide to use the Pitocin? I know you say you weren't contracting as consistently as you would like, but I know that when you augment, you have a better chance of it working. You know what I mean? Opposed to when you're trying to induce a labor that hasn't started or whatever. So
yes.
did that
So
inform? Oh, go ahead.
Oh, I'm sorry. I didn't mean to cut you off.
No, you're fine. Go ahead.
Well, from the preterm contractions, they put me on medicine for it, and then I stopped it at around 36 weeks. And I had already started dilating, so I'm like, I have this base. My water's broken, so my body's, it's trying. It might be a little slower than I would like, but it's getting there. So I did feel more comfortable going ahead with the Pitocin, just as opposed to coming in at nothing and trying to force myself to go into labor.
Okay. So what was labor like?
Okay, so my water broke. I woke up and found that my water was broken at like around 6:30, but I don't know how soon before that it happened. Once I got to the hospital, it was like 10:40, and I was officially admitted around 11:30. So they gave me a dose of antibiotics because they didn't know my group beta strep result. I hadn't gotten tested because I was only 37 weeks. And so they started me on an antibiotic, and they want you to get that in and have it or be starting on the second dose before you have a baby. That makes you covered. So for 4 hours after I started that first bag. And so once that first bag got in, they asked me, do you want to go ahead and start with Pitocin? I'm like, yeah, that's fine. So I was in labor, I guess, from 6:30 a.m. until 1 o'clock. We started the Pitocin. And then I still didn't have like frequent or painful contractions until 4:30. I felt my first painful contraction at 4:39.
Okay.
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 And it took my breath away. And so then I had like 20 more minutes of contractions like that. And I'm like, can you check me, please? Because I want to know like where I am.
Yeah.
And so she checked me and she's like, you're kind of a 4. And like, as a nurse, I know that,
you like what?
4. Like I can probably stretch you to a 4, like 4 centimeters dilated, but you made a little change, but not a lot. And so I had been on Pitocin since 1 o'clock. And for some reason, I just was like, this should be going much faster than that. Now I realize like I was fine. But yeah, so I had that contraction, and then baby was born at 8:14. She
Okay.
probably complete at 8 o'clock. So I mean, labor was those 4 hours were hard.
Yeah, because that's pretty fast. So I mean,
it was. Um, so they kept increasing the Pitocin until, a little bit after that 4 o'clock mark. Once she checked me, she was like, "You're still not, changing a lot, so we're gonna keep going with Pitocin." I'm like, "Okay." I was like, so like it focused inward. I was like, I just gotta, I gotta get in my head and like do this work. I thought that I would want to have like a bunch of support and stuff like that, but not really. I mean, I did have a lot of support because my mom was there, my doula was there. Once I like accepted that, she should come, because she's like, you need to be up and moving. My mom's like, call your doula, and I'm like, no, it's fine. Like, I'm gonna be here for a day. It's like, I don't want her to come. She has 6 kids.
Okay, yeah, that's very sweet and considerate.
Yeah,
but
so
yeah, we want to know.
oh, so yeah, so then I did get a dose of IV medication called Stadol. It's like a narcotic.
Okay.
And that was about 7 o'clock. And that's the only part of my birth story that I would change, because it did not take my pain away at all. It just made me super like drunk, so I couldn't really respond to it. So like,
yeah,
I had been like pressing my feet into my doula with like thighs during contractions. It was so weird. Or getting up and like swaying my hips. And so with the medicine, I kind of just had to like lay there with my eyes closed. And
wow,
that didn't feel good to me. I wanted to be up and moving.
wow.
But the medicine kind of, dumped me out a little bit. So I did not like the way that felt.
Okay, so it was like being, like you said, intoxicated with contractions happening, pretty much.
Yeah.
Okay.
When as she was pushing the medicine into my IV, like I felt the baby like drop, and I was like, "Oh, we shouldn't have done that," because we try not to give it past 6 centimeters, or we don't give it past 6 centimeters because we don't want baby to be groggy when they come out.
Okay.
We probably shouldn't have done that. I think this baby's coming.
Oh,
And
wow.
yeah, so then my friend Tamika came on as my nurse after 7, and she checked me, and she was like, "You're 7 centimeters, like you're doing good." I'm like, "Okay, I got this." And then all of a sudden, of course, I started like grunting and stuff, and they're like, "Are you pushing?" I'm like, "I don't know." And like, I remember like women all like saying that, like they don't know if they're pushing. I'm like, how come you don't know? Like,
yeah, because I'm not doing it. Right.
yeah. And I'm like, I just didn't realize how, like, I thought I was going to be able to like pinpoint everything that I was feeling because I was natural, but it's just not. There was just so much stuff happening, I felt like, to me, that I couldn't focus on any one thing. So when they asked me if I was pushing, I'm like, I don't know. And then I'm like, yes.
Yeah.
Yeah, so then at 8 o'clock, she told me I was complete. And my doctor wasn't on call. It was somebody else from her group. And so they called her and was like, she's natural and she's ready. And so she's like, okay, I'm on the way. Well, we keep a doctor on staff in labor and delivery just in case. So they brought him into the room. And as soon as they told me I was complete, I started pushing, because I'm like, like the nurses have delivered babies before. Like, somebody will catch her. It's fine.
And I can't stop it. So I mean.
And so, but he did end up making it. But he also was one of those people that I had been having conversations with. So he knew I wanted to go natural. So he just stood, back and let me do my thing. Like, they put a drape under me in the bed to keep the bed protected. But they went to like clean me off with betadine, and I was like, no, I don't want that. And they were like, cool, it was fine. And so I remember just, laying there on my side and pushing. And I'm like, Dr. Gray, like, I'm going to push and then you grab her, okay? And he's like, no, that's not the way this works. And I'm like, but if we wanted to, we could. So, like, we can't. And he's like, no. He's like, you're fine. You can do it.
Wow, that's beautiful.
Yeah. And so I remember, like, begging with her, like, Olivia, please come out. Like, you have to, it's time. I'm ready. You're ready. Like, let's go.
Let's do this.
My family says that it was not quite that sweet. That talking about.
Thought I was talking pretty sweet, but I don't know.
So yeah, then she came out, and I was able to pull her out myself. And
okay.
Yeah. And I wanted her skin to skin with me immediately. Like, she was, gunky, but it's my gunk. So.
Yeah, right. Yeah, and after you do all that, it's like whatever.
Yeah, so they handed me a towel and let me stimulate her, and I'm like rubbing her chest. She was sleepy when she came out, so she didn't cry.
Okay.
Like babies normally do. But I just rubbed her chest. My friend Cammy came over and listened to her, and she was like, "Oh, she sounds great. Like, she's quiet, but her lungs are clear. She's good." So, I just like was holding her up and rubbing her and looking at her, and I was still kind of dazed a little bit. So I remember just staring at her, like, what? And my niece is like, why are you looking like that? And I'm like, I don't know. I was like, it's not her, it's me. But I think I was just like so surprised that I had this baby.
And all right, like, did I just? Yeah. Yeah, no, that's true. How did this experience inform your work as a nurse now? Because like you said, at first you were like, you're outside looking in, you have this knowledge, but like you said, you didn't have this bodily experience or whatever. So how has this experience, or I don't know, have you gone back to work yet?
I have. Yes.
Okay, yeah. So how has being in labor and having a labor informed how you interact with patients, or how your work, I guess?
Yeah, so I'm definitely a little more confident when I tell them, like, you can do this, and I feel good being able to tell them, like, I just did this, so I know it's possible for you. But I also know exactly where their head is when they're, trying to go natural and they're being induced and they're on this, this Pitocin dose or whatever. So I definitely, not that I wasn't patient before, but it's just like you reconsider, or my priorities were a lot different once I knew exactly what these women were experiencing. Like, yes, I need to, do X, Y, and Z because the doctor ordered me to, but also this male doctor does not know what you're feeling right now, and I do. So, I was able to be that, the middleman there.
Yeah. Okay. And how do you think? I mean, it's still early, but I guess I'm just thinking, like you just said, you've had this experience, you're a woman, but you're also a nurse, and then there's this doctor that that you're submitted to, or that you answer to. So how do you think being a middleman, like, how do you think this will help you advocate for clients, or are you even like ready for all of that? Like,
Well, I feel like I still was doing, not to like toot my own horn or anything, but I feel like I did pretty well advocating for women. Right now, I think, so, long story. I left the job that where I delivered. I left there right after I had the baby, or like 3 weeks after I came back from maternity leave. I left there to be closer to home.
okay.
And so at the new hospital, I found myself not necessarily having to advocate for low intervention delivery, but advocate for these women to be taken, their concerns and their health to be taken seriously. I felt like, a lot of like warning signs they had, or like more, like, disease processes or things that were happening weren't being acknowledged the way they would in somebody that didn't look like us.
Right.
And so that's the fight that I've had since I've come back from maternity leave. Not necessarily, the low intervention deal hasn't been hard to navigate. It's like getting doctors to believe and appropriately treat these women.
Yeah. Wow. So what advice would you have for other nurses who are inside this situation? Because I understand that could be tough,
So just to drop your biases, like in the hospital, the hospital that I moved to, people would come in and they were automatically, like they had already lost before they even started, because of how people felt about them, because of how they looked.
Mm-hmm.
I would have moms who, would come in like addicted to some substance or whatever, and they were already counted out. And that heavily influences the way that their birth turned out, And so I think that's my biggest thing. Just drop your bias at the door. Like, it doesn't serve anybody when you're working with this population. It doesn't do any of us any good. So.
Okay. Well, wow. Thank you so much. You are a wealth of knowledge, and you're just the perfect person to interview, because you're a labor and delivery nurse, you're a Black woman, you are a mother now, a new mother, whether the experience is pretty rarely fresh, and you're a doula, and you kind of had a low intervention birth, so it's just the perfect person to interview, especially for the Genesis Birth and Living model, which believes in low intervention and advocacy for Black women. So I really appreciate your time and your enthusiasm and your knowledge. And I mean, just thank you.
Well, thank you for having me. This is really exciting to be like, finally the person on the other side.
Oh, yeah, that's great. That's great. That's what I said. That's mostly what drew me to you is that you were. I think the last line of the post I read said, I'm an open book. So if you have questions, and I just love to see that. Like I love to see that because so many times we walk away from our birth like I don't want to ever talk about that again. And I love to see when we can walk away wanting to talk about it. And I think it gives the rest of us hope that okay, this can be different. Or maybe whatever happened to me was not necessarily all my fault, and it was just these factors at play. Um, so thank you, Abrielle.
Yeah.
Okay, I'm just me and names. I don't know what it is.
It's a mouthful. It usually takes people a couple days of knowing me to get it right. So.
Okay, yeah, no, it's not hard. I just run into people, so many people, and I just forget. And then I'm a mom of like 4 kids, and I'm pregnant right now, so my brain is just thank you, thank you. So my brain is just shot. I just
yeah. I still have in the brain. I'm pretty sure.
Right. It does not get better. It's your mom. But Ariel, thank you so much. Is there anything you would like to share in closing that we didn't cover, or?
I guess maybe this was not necessarily pertaining to birth, but I spoke about this in my post a little bit, that I had this aversion to nursing at night postpartum, when I was postpartum, or early postpartum. For some reason, I just, like, it felt like, I don't know if you've ever experienced restless legs. So, like, I wasn't in pain, but it was just like, I did not like it. Like, there was a serious aversion. And I mean, I did it and I got through it, but I knew that was normal because I had like seen people have that. I think it's called like DMR or something, but they had that aversion to nursing, around the clock. And so I knew that like having it at night was not, a huge deal. And if I felt, that bad, I would just give baby a bottle. But I think that's something that, a lot of people don't hear about. I know a lot of people that I know didn't know anything about it. So that's just a little something that I.
Well, thank you. No, now that you said that, I experienced that with my first baby. I don't know if it was particularly at night, but there was just sometimes with nursing, I just felt like, get off me. Like I just, yeah, you just like I don't know. Like you said, I don't know what it is. It's like just this. I don't know. I just you don't want to be touched or something. I don't know. It was weird.
Right.
No, I appreciate that. Thank you for sharing that. Oh, and something I forgot to mention in the last few minutes. You mentioned that you had type 2 diabetes. How did that affect your pregnancy and your birth? And like, if I'm a woman with diabetes, what should I be concerned about? What can I have faith that I'll be okay through? What are my, I don't know, what's that like?
Gotcha. So I was diagnosed as a type 2 diabetic. I think I was like a sophomore in college. It was after a car accident. I started having restless leg like issues. And my doctor was like, well, let's just do some lab work to make sure it's not something we can treat before we send you to a neurologist. And so she did the test or whatever, and my hemoglobin A1C was high. And so that is a test that like tells us how high your blood sugar has been over the course of 3 months. So I had just gotten out of a relationship, like my first serious relationship. So I did not have like healthy eating habits. I had gained like 20 pounds, like super quickly. I wasn't eating well because I was in college. So I had like 3 coffees a day while I was on campus. And then at night I binge eat, so definitely wasn't taking care of myself. But they diagnosed me then. But in pregnancy, my A1C was 5.4, the highest it was in pregnancy, and the pre-diabetic range starts at 6.4. So I don't feel like I'm a true diabetic. But they did have me see maternal fetal medicine. So I think I started that maybe at 17 weeks. And I did that every 6 weeks and then every 4 weeks, something like that. And then I was supposed to start every 2, but then I had the baby. So they had me getting growth ultrasounds every visit with MFM. And I mean, I guess it took extra time out of my schedule. They had me tracking my blood sugars, but it wasn't, it wasn't that huge of a deal. But they do try to like induce you. They want to induce you at 39 weeks if you're diabetic, even if your levels are fine. And so I think like knowing that doesn't have to happen is important. If your blood sugars, you're able to control your blood sugars, your baby is growing appropriately, your placenta is functioning normally, that's, it's fine. A big baby is also not a reason to be induced. Some people are just big and you can't get up.
Yeah.
So just knowing that a big baby is not an indication to have your baby early. You don't, unless there's like some really like crazy anomalies going on with your pelvis, you usually don't know that your baby's too big to fit through your pelvis until the baby tries, So
Right.
Don't let anyone tell you at 32 weeks that your baby's not going to come out of your body.
I love that. Thank you so much. So just to reiterate, because that's one of my big things, I get that question about it. I have gestational diabetes and I'm going to be induced. And I don't know much about that, to be honest, and I've been wondering, like, is that necessary, but it's good that you gave specific questions, like, is my placenta functioning properly? Are all my levels of my baby fine? Are there any problems at all? And then the other one is, I've been told my baby's too big, so I have to have a C-section because I've been told that, my baby won't fit through my pelvis. So thank you for addressing those two things. Those are really big questions that I get all the time, or that when I'm talking to women, that I hear people say. So, well,
and that's not to say that like people with these, comorbidities like high blood pressure, diabetes don't have issues, but there's a way to manage things, and if you're supporting your body well, then like there's not, we can't say that things are going to go left for you. Things don't go left for everybody. So, just trust that if you're doing what you're supposed to treat your body the best way, to support your body in the healthiest way you know how, then trust that, lean on that.
Well, thank you so much for that. It just gave me some courage. So it's the fifth baby, but you still always are like, oh gosh, just anything can go wrong. So thank you again, Aria. I really appreciate your expertise, your time, your enthusiasm to share your experience. Everybody's tuning in. I hope that this blessed you. I hope it was very informative, inspirational, all those things. Like I said, if you haven't already, like, subscribe, share, and put your questions below. I will send this to Ariel once it's all uploaded, and if she feels so led, she might answer them. I don't know.
I will feel led. I will talk about birth. I'll do it for days on end if you let me.
Okay, all right. So with that being said, y'all might see her again. I might, like, once I find people, you stuck with me. So
okay.
So thank you again, and I'm gonna go sign off, you guys. I will see you in the next episode of Listening to Black Women. Thank you for tuning in. Please, again, like, subscribe, share to the Genesis Birthing and Living YouTube page. We're also on Instagram, Facebook, and WordPress. All right, I'll see y'all later.